Good afternoon and welcome back to our media briefing. Yesterday, the Board of Supervisors held a very productive meeting where we acted on several measures to help the region during this pandemic. I'd like to go over just some of those issues that we dealt with before we provide our medical update. First, with about $48 million in additional federal CARES Act money coming to the county by way of the state of California, the board decided and identified some focus areas where these dollars could be used to support our ongoing fight against COVID-19. Those areas include financial support for child care businesses who were left out of the previous stimulus programs, performing coronavirus testing at schools, looking at expanding testing along our international border so that we can better monitor people who are legally allowed to cross the border and to help slow the spread of the virus in hard-hit South County. And finally, looking at ways to support other food assistance programs like the Great Plates Delivered program, which provides home meals for seniors. Our Chief Administrative Officer will come back to the board next month with a detailed plan on how that money will be used to address these areas. The board will take a final vote on the spending plan at that time. Another step we took was to help our region recover from this terrible pandemic is the creation of a small business stimulus program that will provide $17 million to small businesses and nonprofit organizations. We know this pandemic and the restrictions it has created has made this a difficult time for many businesses and nonprofits. This program will help them keep jobs in the region, purchase personal protective equipment for workers, support renovations to allow for outdoor operations, pay vendor invoices, and help with a variety of other needs. This funding will be split among each of the supervisorial districts. These offices know their districts best, and they will make a determination on the grants. I urge you to contact your supervisor for more details, and for more information on the program, you can also visit san-diego-county.gov/stimulus grant. We are committed to helping small businesses in our region survive and recover from this pandemic. We believe that these efforts and others we have taken will help many San Diegans. And with that, let's move on to the update, and I'll introduce Supervisor Fletcher.
Thank you, Chairman Cox, and good afternoon. One of the great challenges as we work our way through this new normal and the realities we face with coronavirus is at times it's cast as a choice between are we tackling the public health crisis or are we tackling the economic crisis. And the reality is you have to do both. We cannot have a healthy economy and we cannot get folks back to work if we don't slow the spread and have the coronavirus spread under control. And so we have to be mindful that it is not a choice between one or the other, but the two actually go together. They're complementary to one another. We want to get our economy back up and running. We want to get folks back to work. But in order to do that and do that successfully without interruption, we're going to have to come together as a community to really focus our efforts around all of the things that we need to do to slow the spread. Another part of that is recognizing the great difficulties that a lot of entities are facing. And you've seen a lot of action both by our county in terms of some of the things Supervisor Cox just mentioned, along with things the state's doing and the federal government's doing to support our businesses as they try to get back to work, and in particular to support our workers that have been negatively impacted by what's happened. But I think yesterday the board took a very positive first step in recognizing that you cannot have a thriving and healthy economy. You really can't have any economy if we don't address the issues of child care. And so yesterday the board took the first step in allocating the majority of the new money to two proposals that we brought forward. One around making a $25 million investment in helping our child care providers. Since March, we've seen more than 600 child care providers close their doors. They are facing tremendous difficulty as they try to get back up and running with limitations on the normal number of kids they have, with the physical distancing things, with what they need to do around PPE. And so I think making an infusion into an effort to provide regional help and support to really strengthen and build up our child care capacity is not only good for those entities, but the reality is you can't expect parents to go back to work if there is not available and accessible child care that's in a safe environment, and I think that's an important step. The other action that we took around testing was to make an initial commitment, or the first step, we'll come back at our next board meeting and ratify it, around dedicating money for testing around schools. I know there's been a lot of conversations and discussions around school reopening. Obviously, we're working with our County Office of Education, with our various school districts here in San Diego County, along with the state of California, to come up with the guidance and the framework around what those schools will look like and what configuration they may be. We're also in a period right now where we're dialing back, but we have to prepare in hopes that we do slow the spread and we begin to continue on our reopening and moving forward for the eventuality that schools will come back in some form or fashion. And so we've been working very closely, my office has, with the school districts, with the county office, with superintendents, along with some of the best minds around testing, about what we could do to provide some measure of maybe surveillance testing, perhaps wastewater testing, maybe some combination of bundling testing, some dedicated diagnostic testing, maybe for teachers and staffs. But we're brainstorming, we're working, a lot of folks are working very hard to try to put in place some system that would give us the best opportunity to monitor what's happening. And so I'm grateful for the Board of Supervisors for taking, again, the initial step that we need to take to address the public health aspect around testing in our schools. Both of these measures, I believe, go a long way to helping ensure our economic recovery can be real, and just the simple recognition that if there's no child care and there's no school, there can be no realistic expectation that folks can go back to work. And so we think these are vital components, not only for our public health, but also are vital for our economic health. And so we will continue to work on those and keep everyone posted. With that, let's jump into our numbers update today, and then we'll turn it over to Dr. Wooten for her update. We'll start first with our T3 strategy, test, trace, and treatment slide as our first one for today. Today we're reporting 7,607 tests conducted. That is slightly above our 7-day average, which we have been, again, continues to be in a very strong position of 7,434 tests, our 7-day average. So we're above that. Additional contact tracers, we're now at 474 contact tracers. Today we surpassed more than 400,000 tests that have been reported countywide. We also surpassed more than 20,000 investigations that have been performed, along with more than 1,000 individuals who have received help in our county public health motel rooms. The next slide we'll look at is our COVID-19 percentage positive. Yesterday was probably the single worst day we've had. Today was much better. Today we're reporting 264 new cases out of the more than 7,000 tests performed for a 3% average. So again, today, we look at the rolling average, and you can see the purple line there. It's gone up significantly since the middle of June. That's the line that we want to see come back down and hopefully remain stable. Daily hospital census on the next slide, you can see right there in the orange is our COVID-related and ICU. COVID-related was down just a little bit. Non-COVID-related was up, and so day-to-day, we are up a little bit, 479. In the next chart, you can see where that 479 is relative to the total hospital census, the total hospital occupancy or utilization at 4,023, both COVID and non-COVID beds in use. Next one is our ICU, again, holding steady there, right around 71% occupied. Our COVID numbers went down just a little bit yesterday to today. Non-COVID went up a little bit, but our ICU utilization is holding steady. And it is important to once again remind that hospitalizations tend to be a lagging indicator that comes several weeks after a significant uptick in cases. That concludes my section of the report. I'll now turn it over to Dr. Wilma Wooten for her public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. Our global, national, and state statistics are on this slide, and all of this information is based on the Johns Hopkins dashboard and was obtained today at noon. I will start to provide detailed information regarding our San Diego stats, which are through through 11:59 last p.m. Currently, we have 17,842 cases, which is 264 more cases than yesterday. As well, this includes 406 deaths, with 7 new deaths reported since yesterday. And the age range remains the same, 3 months through 102 years of age. Now, 10,256 or 57% of the cases are between 20 to 49 years of age. This overall percentage is continuing to increase from just over 50% at the beginning of the pandemic in March to now at 57% after about 4 months. And from the very start of this pandemic, the individuals in this age group, again, have represented the majority of cases. Now let's examine a further detailed review of this age group. The 20 to 29 age group makes up 24% of total cases. 30 to 39 makes up 19%, and the 40 to 49 makes up 14% of all cases. 9,084 or 51% of our total cases are female, 49% or 8,632 are male, and only 126 individuals have no gender identified. 1,961 or 11% of cases have been hospitalized, and 524 of the total number of cases have been admitted to the ICU. Now, this number is 3% of the total number of cases and 27% of the total number of hospitalizations. Regarding deaths, in the next slide, there are 406 total deaths, which represent slightly over 2% of the total number of cases. 44% of cases are female, 56 are male. 386 or 95% of total cases had underlying medical conditions. 19 did not. And as always, our sincerest condolences and sympathies go out to the family and friends of those individuals reported today, as well as prior cases who have lost their lives to COVID-19. So in the next following set of slides, we want to talk about tests, cases, hospitalizations, ICU admissions, and death data over the past months and more recent weeks of this pandemic. The slide related to testing, as Supervisor Fletcher has stated, and you can see clearly here, there have been consistently on average over the 6,600 cases, which was our target for stage 3 of the pandemic recovery. But we are well over that, actually on average over 7,000. And this is approximately, it's well over 2 tests per 1,000 population. In the next slide, this slide shows new cases, and today the number of new cases is at 254, which is a nice decrease compared to prior days. So it would be nice to see that trend going down, but each day will bring new evidence of new cases. As we continue, and we are continuing to test at the various sites, as has previously been shared with the community, particularly sites that reach the underserved populations. In the next slide, this slide shows hospitalizations, and yesterday the total number of 30 new hospitalizations. In general, hospitalizations, with the exception of the last 2 days, but again, this last week, higher numbers, higher than the prior week. So we will continue to monitor that. In the next slide, while overall, as stated, the number of hospitalizations is decreasing in the past several weeks, hospitalizations are increasing. So this slide clearly shows that from 6/21, to present. This shows how hospitalizations are increasing. And in the next slide, this shows new ICU patients, which is a subset of hospitalizations, and we see that these numbers also are remaining consistent. Next slide shows our number of deaths. As stated, hospitalizations, then deaths lag behind the reported cases, and we are going to talk about outbreaks, and that even lags further behind hospitalizations and deaths. And as you can see here, over the holiday weekend, no deaths reported, but you can see 12 and 7 deaths were reported over the past 2 days. In the next slide, this is our epi curve. And here you can clearly see that, particularly in the latter part of April through May and the very beginning of June, we had flattened the curve. In the next slide, this may support or give some credence to the increase in numbers of cases. On June 12th, the state reopened gyms and other facilities and other businesses. And since that point, we have had an increase in cases. And under the bar, the last 14 days, we know that we will have more cases. So those histograms we expect to be taller, representing new infections or new cases. In the next slide. So we want to transcend here now to outbreaks. And since the beginning of the COVID-19 pandemic in San Diego County, there have been over 180 outbreaks in congregate settings and community settings. Of the 180 outbreaks, 86 or 48% are now closed and inactive outbreaks, meaning that there have been no new outbreaks in these settings for the past 14 days or longer. Now, of the 180 outbreaks, 94 or 52% are still active. The 94 active outbreaks include 23 or 27% of the active outbreaks are in our San Diego County's skilled nursing facilities, which are 86 in total. There have been no new outbreaks reported in this setting since yesterday. We have had 2 outbreaks that have become inactive since yesterday in this setting. This setting represents a total of 1,097 cases, which is 6% of the total COVID-19 cases, and 830 COVID-19 lab test results, which is 5% of the total COVID-19 cases. 27 or 29% of the 94 active outbreaks are in non-skilled nursing facilities or other congregate settings, and there have been no new outbreaks reported since yesterday. 1 outbreak became inactive since yesterday, and this represents 1,194 total cases, which are 7% of COVID-19 cases. And lastly, the next setting is community settings, which represents one of our triggers, 13 triggers. To date, currently there are 44 or 47% of the 94 active outbreaks are now in community setting locations. There are 5 new outbreaks reported since yesterday, and there are 740 cases, or 4% of the total COVID cases reported. Now let's transition our attention to the triggers. In this slide, you will see that represented by the red X, we have 3 triggers that are abnormal. The first is case rates, which is also a state metric, and the metric that is responsible for our being on the state's monitoring list. So that continues to be abnormal. The second is outbreak. Community outbreaks. We have currently 24 as of today, and this metric, or trigger rather, basically is the number of community outbreaks for the last 7 days. And then the third is case investigations, and this is actually was at 57 or 59% yesterday, and this is slowly coming up, and our mitigation for this is bringing on new or additional staff to conduct case investigations. So of the almost 500 staff that we have, over 200 are related to case investigations, and the remaining related to contact tracers, with a small segment of that related to administrative staff. Now, of the next slide, we're going to talk about outbreaks, the community outbreaks that are responsible for that, that trigger being abnormal. And today, in the last 7 days, we have 24 community outbreaks. 3 outbreaks dropped off the list yesterday, and an additional 5 new outbreaks were added. 1 outbreak in the next slide. 1 outbreak is at a restaurant/bar, 1 outbreak is at a healthcare setting, and 1 outbreak at a gym, 1 at a daycare, and then 1 at a resort spa. So these, since July 1st, these are the 24 outbreaks that are currently representative of our trigger number 2 being met. And the triggers that I just, the settings that I just read off are at the bottom in red. Now, these 24 outbreaks collectively represent 137 cases. Let's go to the next slide, which is related to case investigations. And as you can see, the case investigations are increasing, again, due to the mitigation factors that we have put in place that were shared yesterday at the board meeting, and as I've just shared with you. And the primary focus there is bringing on additional staff and pulling staff from other locations that were previously deployed back to their original locations. So we, over the next weeks, we hope to see that that number continues to increase so that we are at the numbers that we held in late June. So I think this is our last slide. This is the slide that outlines the metric that the state uses to currently have us placed on the state's watch list. This is case rate, and this is 100 greater than 100 per 100,000 population. So over the past 14 days. So the way this is calculated is the number of cases over the past 14 days divided by our population times 100,000, and that gives you the numbers that you see in the second or third column that are red. And finally, I cannot emphasize enough that the pandemic is not over, as exemplified by our increasing number of cases, and the virus is still in our community. It is still widespread, and the increased number of cases show this fact. So whatever age group you fall in, or wherever you are throughout the county, it is vital that we remember that our actions have power and can save lives. So in this last slide, just want to reiterate the actions that the general public can take to help decrease the spread of COVID-19. Practice good hand and hygiene practices, as well as sanitation. Keep 6 feet apart, or distancing, our physical distancing of 6 feet apart, wearing facial coverings, avoiding crowded places, and staying at home if you are sick. We have hear about many examples where people knowingly are ill, but they want to go to whatever event that they are going to. We just ask that if you are ill, do not go out into the public. And then last, we're asking people not to conduct any gatherings at their homes or other locations. So now, please welcome back to the podium Supervisor and Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Melissa Adon with NBC7. Please state your question.
Hi there. How is the county working on adding testing sites? Are they targeting any specific areas?
Okay. I believe Nick Machion, who is in charge of our T3 program, is going to come up and respond to that.
Thank you for that question. We're constantly looking at the data of where we need to be putting our testing sites. South Bay, for example, is a major area. We're hearing about Pacific Beach, so we're looking at the sports arena, for example, as a future testing site. One that's coming up most recently, we'll be announcing next week, will be Imperial Beach as a testing site, and a second site is in the Nestor area, also in South Bay. But again, it's the data that tells us where we need to go. Also, with CAL FIRE in our backcountry area, our sites are more mobile as well. So in some locations we're there permanently, and others we're moving around, again, where the public is and improving access for that testing.
Okay, let's go to the next question.
Yes, that'll be Matt Hoffman with KPBS. Please go ahead.
Hi, I have a question about the small business stimulus grant program. How are applications going to be vetted and approved? I know Supervisor Cox, it sounded like earlier you were saying that each supervisor's office, it's like $4 million, and then they themselves will be able to choose which businesses get these grants?
That's basically the way the program is set up. There's a little over 17 million. I think each supervisor will have about 3.4 million, I believe, that will be available in their supervisorial districts. There will be some guidelines on each of the supervisors' webpage in regards to the filing deadline. The money has to be out by, I believe, October 10th, and it has to all be spent before the end of this fiscal year. So it's a very short time frame to work from, and each supervisor will be dealing with the decisions on the allocations.
Gotcha. And then just to follow up on that, what's the time frame from like when somebody puts in an application to when they might be able to get the grant money, and how much can businesses ask for?
Just to clarify, the money must be spent by the end of the calendar year, by December 30th. I think it's December 30th of this year. The actual decisions will be made by the supervisors. It'll have to come back to the Board of Supervisors for approval. And I think the turnaround is going to be fairly short. It's just a question of trying to make decisions in regards to the small businesses that haven't been supported or assisted by other federal assistance programs. And the turnaround, I think, will be in a relatively short period, in a matter of weeks.
Gotcha. So I guess what I'm getting at is they don't have to wait until like October 16th or after that. You guys will make decisions as you guys get applications.
Yeah, no applications will be taken after October 16th, but each supervisor may set earlier deadlines for applications. Okay, next question.
Brandon Lewis with CBS 8. Please state your question.
Yes, my question is about testing capacity. And at this point, essentially, can anyone who wants to get a test get one reasonably quickly? And are there, to your knowledge, appointments for testing that are going unused?
Okay, Nick Machion will respond to that.
Thank you for that question. First and foremost, what we tell folks is that you need to call your primary care provider to make sure we're trying to prioritize those that need to get tested first. Priority groups, folks that have symptoms, or folks that might be of 65 years or older, folks that have been exposed to a positive case, and so on. For our sites, currently we're experiencing about long delays, about 5-7 days for some of our testing sites, some sites even longer. That is why we did establish a site in southeastern San Diego, the Tubman Chavez Center site, where it requires no appointments. Wait times are about 45 minutes. Yesterday we did about 450, for example, appointments in a given day. So we are expanding sites throughout the county for no appointments, for drop-ins as we call them, but where it's possible we are asking people to connect back to their healthcare provider, because whether you come to a county site, a testing site, or one of the state sites, for example, It's really important for those that have a positive test to get linked back to their medical care provider. So it starts there, it ends there if it's a positive case.
Thank you. And I also wanted to ask about this period that we're in on the state, from the watch list and now with these restrictions. I know a lot of us heard this 3-week time frame, and I'm wondering if you can tell us what happens at that 3-week time frame. Do things get reassessed, and are we instantly going to see those restrictions lifted?
Are you referring to the watch list and our being on the watch list for the next 3 weeks? Is that what your question is related to?
Correct. The
Yes.
restrictions that were imposed by the state, yes.
Yes, absolutely. That is the anticipation that in 3 weeks, that metric will be reassessed, but we won't wait until the 3 weeks. We monitor that metric every day. So we will continue to monitor the data related to that metric, and what the result is in 3 weeks will determine what our next set of actions will be, but those guidance will come from the state. Thank you.
So the state will reassess in 3 weeks and could decide to keep it longer or perhaps remove them. Am I understanding you correctly?
It's a joint assessment. We assess those data as well as the state, but in terms of the guidance on the next steps, that will come from the state. Thank you.
Thank you.
I'd like to come back to that first question about capacity. I'm not sure if I addressed that adequately. So the testing done by both the county, the state, and all our hospital partners and commercial labs, evidenced by the increased demand on testing, we added about 1,200 more testing appointments for our drive-up sites this week. There'll be 2,000 more next week. So for those that may attempted to come to the website, I encourage you to do that now because there are more appointment times for people, so make it easy for people to get an appointment earlier than the 5 to 7 days.
Okay, we'll go to the next question.
Hunter Sowards with KUSI, please state your question. Okay, we'll go to the next one.
Okay, we'll go to the next question.
Paul Sisson with the San Diego Union Tribune, please go ahead.
Thank you. 38 hospitalizations yesterday is a large number. I'm not sure if that's a record or not for a single day. What can you tell us about the people who were hospitalized yesterday? Did they fit a certain general demographic? Were there any interesting observations there in terms of who is now getting hospitalized?
Okay, Dr. Wooten's going to respond.
Thank you for that question, Paul. We haven't been able to analyze the numbers that were reported just yesterday, but that is, staff has been asked to look at actually hospitalizations over the last 2 weeks, just to get an idea of what that more closely looks like as a subtotal of the total number of cases over the last 2 weeks. So we have not had the opportunity today to do that, getting the numbers just at about 2 p.m., but we are looking into that. So thank you for that question. And as soon as we conduct those analyses, we will either share it at next week's press conference or through any of our daily news briefings. Thank you.
Thank you. I have another question about testing. Got a few calls here recently from people who said that they went to the county website and tried to schedule testing, and slots were filled up for the next 10 days, and valued additional slots due to additional, I guess, demand for testing. Can you say a little more about what's driving that demand? Are these folks who are just worried that they might have it? Are these more folks who actually have symptoms? Do you have any sense of what's driving this increased demand for testing?
Not sure of the demographics of the individuals that are requesting testing, but to add additional information. I think that answers the question. We just don't have any, we don't interview or gather information, Paul, from individuals that are scheduling, so not sure. But I would imagine with our sharing information on a daily basis about the increasing number of cases, people may be concerned, and that is certainly or could be a driver to cause people to want to be tested. But as our agency director, Nick Mascione, stated earlier, everything starts with and ends with one's medical provider. So we ask people to make sure they check in with their medical provider. Thank you.
Thank you.
Just to add to Dr. Wooten, Paul, to your question, when we add 35 different sites in the county, making it more accessible, we're going to capture more folks. So our testing by design with intentionality was to get into communities. So that's been one. Obviously, the events happening and the awareness is another driver of getting people there. So we're trying to make it easy. When we went to online appointments a number of weeks ago, that was a huge driver to that. And to your point about people who have called in or went into online, haven't been able to get an appointment, encourage that to try again. Because we added those appointment slots again, responding to the increased demand, and then the drop-in center at our site at the Tubman Chavez Center. Very important. Again, you don't have to wait. You can go. It's going to be a little bit longer wait, better than DMV, but you'll get a test that same day taken. So encourage for those that need to do a drop-in immediately. Thank you.
Thank you.
Okay, we have one final call-in question.
Yes, Hunter Sowards with KUSI. Please state your question.
Hi there. Why is the metric of cases set at 100 per 100,000 people? Why is that metric not higher?
Okay, I think I'm going to ask Dr. Wooten to respond to that.
Hunter, that is a metric that was determined by the state, and I'm actually not sure what all went into describing or determining that metric, but it is a state metric, and that's why we changed over to that. Well, that is one of the 6 metrics, and that's why we included that metric on our 13 triggers document as well.
And Dr. Wooten, I'm curious, do you feel for San Diego County specifically, do you feel this is a good metric in terms of deciding whether or not we move forward or dial back, just from your perspective?
Oh, absolutely. We trust the information that we get from the state. They have their epidemiologists that determine what these various metrics could be. Some of these metrics are related to the federal gating criteria, and others are not, but overall, all of these metrics have been developed and validated by the state. And then the ones that we've developed, we have done so based on the science and evidence as well. So very confident that that is a good metric.
And then as far as the community triggers go, do you feel that the number set there, is it something that's realistic in terms of based on San Diego County?
Well, the original metric, which is 7 outbreaks in the last 7 days, we actually had it lower, and based on input from our epidemiologists, our senior epidemiologists, we increased that. But it was based off of the prior history. So in March, we had, I believe, 13 outbreaks. In April, 11 outbreaks, and for the month of May, there were only 3 outbreaks at the time when we developed the matrix. So it was basically an average of all of the outbreaks that had occurred to date. And I would also like to share with you some additional information, just looking at all of the outbreaks, all of the 84 community setting outbreaks. Actually, here we have March, there were 3, April 16, May 8, which is 10% of the total, June 34, and July, which is, we're only 7 days into July, we have had 27 outbreaks. And if we keep on at this track record, we will have 81 more outbreaks. That's basically 27, or rather 23 outbreaks a week. So the outbreaks, again, after deaths, is a delayed impact of increased numbers of cases. And the quicker we can identify the outbreaks, and our EISB, or epidemiology department, has done a very good job in determining if there are any associations between the various cases. So this is the tip of the iceberg, and that's why it's very imperative that when we identify an outbreak, it is given to our outbreak team, they confirm it, and we act and conduct any assessments of the locations where the outbreaks are located. Our Department of Environmental Health does a great job with the restaurants, and we are developing a process to develop site teams that will go to other businesses or work sites to look at these outbreaks, and also to enforce the guidelines that we have in place overall for this epidemic and the COVID-19 pandemic. Thank you.
Thank you, Dr. Wooten.
The first two text questions that we received are related to the reopening of schools, and this first question is from Cliff Albert with Kogo. With the threat by the president in a tweet today to cut off funding if schools don't open by the fall, what can you tell parents, students, and teachers about what the county will recommend when it comes to opening schools in light of the surge in cases and hospitalizations we are seeing?
Right now, what we do and what we've always done since this pandemic has started is work in collaboration with the San Diego County Unified School District. And in our health officer's order, we refer to the guidance from the state, and you have that available to you. Also, we asked the schools to use the plan that was also developed by the California Department of Education. So we will continue to work in collaboration with the school districts, but I can't tell you at this point in time what else is going to happen. So we will report back as decisions are made in collaboration with the San Diego County Department of Education. Thank you.
And then the second question about schools is from Mike McKinnon with KUSI. There seems to be no medical reason that says schools cannot reopen. Do you have any conflicting data?
Well, when schools reopen, you have the opportunity for people to gather. And as everyone is aware, increased outbreaks are associated with people gathering. So this is a tough issue. And there are no easy answers. And we've not been in this, the country has not been in this position before. So some very tough decisions will need to be made. We will provide consultation and technical assistance to the San Diego County Office of Education.
This next texted question deals with the tracers and the job that they do, and what happens if they come into somebody who is less than cooperative. And I'm going to ask Dr. McDonald to respond to that question.
And Dr. McDonald, this question is from Gary Worth with the San Diego Union Tribune. Have tracers encountered people who are not always forthcoming about how they contracted COVID? For instance, they may not want to say if they were at a social gathering or dinner party, and may even worry about being fined, which could make it difficult to identify outbreaks.
Well, thank you for that question, because it gives us an opportunity to say a couple things about contact tracers and the relationships that we have, or actually case investigators and the relationships we have with individuals who have COVID, and the need to give us information. First, it's extremely important that we get as much detailed information from people who are suffering from this infection in a timely manner. And the good news is that we usually get that, and we get it in as complete a form that's actionable for us. So we want to thank those individuals for doing that and encourage those that we contact in the future to give us that information. So that's the first point I'd like to make. Second of all, we can only get the information that we get. That is, people tell us what they remember, and what people remember isn't necessarily as complete as either they or we would like. There is a very small group of people who are reticent to give us information at first, and we need to establish trust with them, ensure them that the information they give us is confidential, and that that we need to sometimes build a relationship. It takes 1 or 2 calls sometimes to build that so that we get the information that we need. A very small group of individuals don't give us any information because either we can't contact them or they just refuse to give us information. And again, we do rely on complete information to us to be able to take public health action. And the good news is that most San Diegans understand that, give us the information, allow us to act on it, get in contact with the friends and family of those individuals to give them the best information that we can to get this outbreak under control.
Just to add to Dr. McDonald's response, what our county did with our community outreach workers, what we call promotores, is just another element to go above and beyond. As a complement of our tracers and disease investigators, this is through San Diego State that's onboarding these folks. They're from the community, they know the community, and so they're following up. Again, trying to make that trust relationship, as Dr. McDonald talked about, and sometimes multiple contacts. And that is a little bit unique to San Diego in doing that type of work. So we have both county employees and community workers coming together and trying to make sure we can make those contacts successfully.
This next question deals with outside dining, and we'll go ahead and hear the question.
This one's from Claudia Busho with Univision. Just wanted to know if there are plans on adopting a countywide order that will allow outdoor dining on sidewalks and private parking lots, or will it be up to each city to decide on whether they want to waive permits?
Each of the 18 incorporated cities in San Diego County will be making those decisions within their jurisdictions. In the unincorporated area of the county, our Planning and Development Services Department has a process set up. In fact, if anybody is interested in expanding their service into the outside areas, they can get on the Planning and Development Services website. There's information and directions there, and they can certainly try to accommodate them in tandem and in concert with our Department of Environmental Health.
And then there is one final question. This one is from Carlo Cicchetto with News 8. Are short-term rentals still allowed at this point, and if so, why? It seems counter to stay-at-home orders.
Okay, Dr. Wooten's going to respond.
Thank you for that question. The short-term rentals are included in a guidance that was actually recently issued by the state on July 2nd. So there are provisions for that, and we would just encourage individuals to follow the guidance as stated in the CDPH's guidance.
Well, that completes our questions for today. We are not scheduled to have any media briefings for the rest of this week, but we will return next Monday. And as always, our communications office will send out media updates and information. Will be updated on a regular basis on our coronavirus website, which is coronavirus-sd.com. Obviously, we're in a very critical stage, and we certainly have had to make some decisions I think none of us wanted to make, but we can't let our guard down. We ask you to continue to take the measures that we've talked about to protect yourself and others. And again, we ask you to please wear those masks anytime you go outside. Please maintain that physical distance of at least 6 feet. And again, just be courteous and try to, help us get all through this pandemic together. With that, we would tell you again to stay safe, San Diego, and we'll see you next week. Thank you.